Hello toppers. This video is about surgical jaundice or obstructive jaundice. First, what is jaundice? Jaundice is nothing but yellowish skin pigmentation which is caused by elevation in serum bilirubin level, that is also termed as icterus. When we can clinically get this icterus? And when this will be evident by looking over the sclera itself. If the level or if the serum bilirubin level goes beyond the 3 mg per dl, we can easily found from by looking over the sclera itself. Why we are concerning about sclera? Because yellowish skin discoloration also occurs with elevated serum carotene level, but their scleral pigmentation won't occur. So this is important for jaundice. Next comes etiology. Here we are classifying the causes: prehepatic, hepatic and posthepatic jaundice. First, prehepatic. Here problem occurs with the overproduction or impaired uptake by the liver. So major causes are lies over the hematological issues or blood RBCs or hemolysis or hemoglobin synthesis problems. Next comes hepatic jaundice. Here occurs the impaired uptake or conjugation or problem occurs while excreting the bilirubin. And the major causes are cirrhosis, viral hepatitis, drugs or tumors over the liver or neoplasia in livers. Comes post-hepatic jaundice. Here the problem occurs at the level of hepatocytes or in bile ducts. Here regurgitation of unconjugated or conjugated bilirubin from damaged hepatocytes or bile duct occurs. So the major causes can be gallbladder stones, bile duct obstruction or other gallbladder pathologies or carcinoma in pancreas or bile ducts or anything. Now, normally bilirubin processed in the liver and it leaves the liver in the bile fluid and flows into the intestine. But when there occurs the blockage at the level of bile duct or pancreatic level, there occurs the backflow of bile because of any mentioned causes. In this picture you can able to see. Here bile flow is blocked. So when bile flow is blocked, bilirubin level gets increased and that causes jaundice. As it is surgical jaundice, we are going to talk about only post-hepatic jaundice or obstructive causes only. So these are all the different causes of obstructive jaundice or surgical jaundice: biliary atresia, choledochal cyst, CVD stones, ascending cholangitis, strictures in biliary apparatus, carcinoma of head or periampullary region of pancreas, cholangiocarcinoma, also parasitic infestations. And here you can see clot skin tumor. This can also cause obstructive jaundice. So the causes can be congenital like biliary atresia, choledochal cyst, or it can be inflammatory like cholangitis, sclerosing cholangitis, or it can be obstructive like stones, strictures, parasites. It can be neoplastic or it can be because of extrinsic compression of CBD by lymph nodes or other tumors. So here Benjamin classifies the biliary obstruction. There are 4 types as per his classification: type 1, 2, 3 and 4. First one is complete obstruction. Complete obstruction occurs because of pancreatic tumors or cholangiocarcinoma, or it can be due to primary or secondary liver tumors. Next comes intermittent obstruction. This occurs because of choledocholithiasis, periampullary tumor, bile duct papilloma, hemobilia or duodenal diverticula. Next comes chronic complete obstruction. This occurs because of any congenital causes or traumatic or post-radiotherapy, sometimes seen in cystic fibrosis. Next comes segmental obstruction. Most commonly it may be due to traumatic cause or sclerosing cholangitis or due to stones. So complete obstruction, intermittent obstruction and segmental obstruction, they are the most important classifications. Now let's discuss the effects of obstructive jaundice. First, in liver. In liver, enlargement will be seen. So here bile stained liver will be there. Hydrohepatosis may be seen because it shows dilated intrahepatic biliary tree. And so because of this pooling of bile, here occurs the pressure increases in CBD. So there occurs white bile in CBD. Finally, biliary cirrhosis may develop in later stages. Next, effects in biliary tree. Here occurs recurrent inflammation that leads to cholangitis. There occurs the fibrosis. Next, intestinal level or bowel. Here, because of the absence of bile from bowel, digestion will be impaired. That causes the reduction in fat absorption that makes the feces bulky and fatty. Next comes vitamin K absorption is reduced. So there occurs the fall in prothrombin level. That causes coagulopathic disorders. So coagulation profile will be altered. Pale, bulky stool, dark urine and jaundice are the most important clinical features what we can get in this case of obstructive jaundice. If the obstruction occurs because of cholangitis, we can able to get Charcot's triad or Raynaud's pentad. And Courvoisier's law will help us to diagnose the inflammatory causes or neoplastic causes. Also, gallbladder will be palpable in case of CA head pancreas. Now, next comes the investigation. As we know already, serum bilirubin level will be increased. So, there occurs conjugated hyperbilirubinemia. Also, serum albumin globulin ratio will be altered. Also, prothrombin time and total count should be noted. In inflammatory conditions, total count may be raised because of neutrophilia. We can go for ERCP just to visualize the site of obstruction or to get biopsy. And we can go for MRCP if we have to do non-invasive diagnostic techniques, and it has 96% sensitivity and 99% specificity. And if we are thinking about some cancers or neoplastic lesions or something, we can go for other tumor markers also. So hereby we are concluding obstructive jaundice. Thank you.